Hello, everyone. Our mini lecture and focus for this week is on health policy. So this first workbook provides an overview of Australia's health system. We shall try to identify which levels of government are involved in health policy and how they are involved. We shall also try to explain which stakeholders contribute the most funds to different areas of health policy. And we shall also try to explain what is meant by a two-tiered system of health provision. So before anything else, I would like to start by defining a few concepts which you might find useful in understanding health policy. We shall try to look at the concept of health policy itself. What does it mean? Shall also try to understand health system and a few other concepts really, like the local health network, which again you might find useful in defining health policy. So when we speak about health system, we are really talking about an interconnected set of interconnected organizations and stakeholders intervening in the health sector. These may include the federal government, the state level health departments, and service providers, and even funding bodies. So largely, broadly, when we are talking about health policy, the number one biggest thing or biggest concept you might come across is this concept of health system. So the system in many countries, including Australia, aims to provide accessible, equitable, and efficient healthcare for all citizens using coordinated policies and governance structures. So the whole concept of public health is based on, how the health system operates and who does what, how are services coordinated, and so on and so forth. So in a sense, the concept of health system encompasses everything from the funding, regulation, and including service provision. So it's almost like the biggest concept covering everyone intervening in the health sector. Then there is the concept of health policy itself, which really entails the frameworks, the laws, strategic priorities that set the directions and the expectations for health services at national, state, and local levels. These policies tend to define, how things can be done, and often they are really binding not only toward the people providing care, but even for anybody else who's included in the health system. So these policies will tell you what can be done, for example, in responding to emergencies like COVID-19. Policies will be in place to tell you, who can provide the vaccines, for example, who can provide, I don't know, aged care, and who can be eligible to those kinds of services. So policy frameworks also provide, the required standards to guarantee safety, but also that high quality services can be provided and that consumer can be satisfied with the services they are receiving. Then in Australia, we use the concept of local health network, which is an autonomous regional body tasked with operating public hospitals and other healthcare facilities within a specific regional or geographic area. So these might be what in other countries are often referred to as health zone. I might find different countries using the different words, but it is still exactly the same. In Queensland, for example, you might find specific networks like Metro North, Metro South, and Gold Coast being referred to as the regional body or the regional network of different health providers in that area. So The reason why I started with these definitions, it is because they really are very useful for you to understand, and they underpin, in a sense, a unified, high quality and locally responsive public health system. Unless we understand this concept, then we can't even understand, the remaining part of this lecture, which I really want to focus mostly on, you know, health policy and the Australian health policy in particular. Now, the question is, why should we care about health policy and why should we spend all this time really speaking about this? It's because really health, in a sense, impacts everyone. This is, the area of social policy where, again, everybody will find their interest. It's probably the area of social policy that touches the majority of people in society, if not everyone, including aspects of when you are born. Everyone was born. Many people, of course, were born in a hospital. When you when you grow old and you start looking for aged care, then you might want to use a healthcare facility, and even for general health, maintaining things like, your general health, seeing a GP, very regularly, visiting a pharmacist, even going to a counselor or consulting a social worker, a psychologist. All these are still very important areas of of health policy. So when you pay your private health insurance, whether you pay that or you don't pay it, those are still questions of health policy. When you see a health promotion campaigns, quite recently we had COVID-19, and there were many different layers of people's concerns. And again, clearly we could see during that period how important health policy is. So again, I believe many of us might be working in the health sector. And again, really very good reason for us to start embracing this learning opportunity. So you'll have noticed that I'm referring to health policy, but with the word care in bracket. And that's because in the Australian context as well, most policy relates to the provision of healthcare specifically, rather than just being policy in general. And again, as we said, health is one of the most contested area of social policy. And this is, there is a whole heap of reasons why health is contested, starting from the way we define what is health itself, what is considered health, what is good health, what is bad health, what counts as, what leads to poor health, for example, and even who is responsible for managing health. Is it only, individual factors? Is it a public domain? Again, you'll see a lot of debates happening there, and you'll hear more of those as we move on in this lecture. But also an important aspect I wanted to mention here is that, health itself is quite a subjective notion, the same way as well-being can be a subjective notion. Being in good health or in bad health sometimes can appear to be a social construction rather than just a biological or physiological, consideration. There are a whole heap of reasons around cultural beliefs, related to different health issues. We saw a lot of these during COVID-19, when some people could just, resist taking the vaccine because of maybe their religious beliefs or their cultural beliefs. But also, again, many different, factors get to influence health. Historical factors, geographic factors, the sociopolitical context and even economic factors get to shape our health. Later in this recording, in this lecture, we shall be unpacking the notion of social determinants of health to really get to understand how broad the concept of health is and how broad the concept of health policy in particular can be, and really what considerations we need to take into account when discussing about health. So let's briefly start introducing the question of funding, and maybe that will give some clarity on how Australia's health system is organized. Broadly speaking, health again is one of the sectors of social policy where you see a clear partnership between the public and the private sectors. So there is a mixture of public and private, collaborations, whether in funding and even in the provision of healthcare services. And in Australia, as you know already, we are not only, when we even speak about the public, we are not only speaking about one thing, because we have the federal government there, and we have state level and even territory, local government, bodies being responsible of certain things. So in terms of funding, yes, there is a collaboration between the federal and state government as the biggest responsible for funding the health sector. But of course, the federal government, the Commonwealth federal government is responsible for much of the funding of the health sector. So in terms of responsibility, the Australian government sets national priorities and carries overarching funding and regulatory roles. So it's responsible for things like Medicare and the PBS, for example, and all those range of stuff. And then the state level territory, manages public hospital and gets to give license to private hospitals as well. And again, then you have local governments and, the local health networks we started speaking about, they also have a clear role. So in a sense, it's a set of hierarchies defining who does what and under what circumstances. But still, again, the government has a bigger role to play in providing health services across all levels of society. So regulation, for example, is a big role of the government when it comes to healthcare policy. They should be responsible also of training and regulating specific elements of the health sector. So I'd really hope this overview gives you an idea of how Australia health system is complex in its governance, because again, as you have noticed, different levels of government play different roles, and sometimes these roles can even be overlapping and at times even confusing. But my intention was just to really introduce you to these and introduce you to the complexities of the health system and the health policy in particular. Thank you, and see you in the next module.